It's a very common question in a lot of our patients who come with ACL tear. I'm not an athlete. Do I really need ACL surgery? Let me explain how ACL functions. In fact, if you think about the knee joint, we got the thigh bone and leg bone and ligaments on the outer and inner side. These are called collaterals, and the two ligaments in the front of the knee, which are called cruciates. The one which is in the front is the anterior cruciate or ACL. The one at the back is the posterior cruciate or PCL. So ACL not only helps in giving stability, particularly in the rotatory movements of the joint, but also it helps in how the joint moves. It is very important for people to understand this fact. The joint movement is like a glide with compression when the ACL is there. If you lose the ACL, it starts causing friction on the joint surface. That friction on the joint surface, which uneven load, can cause arthritis. If someone had a ACL tear in 20s, their chance of having a arthritis or development of arthritis in that particular knee by around 40 to 50s is very high. It is very clear in the literature. After that, once they develop severe arthritis, they may end up with a knee replacement surgery. There are certain criteria we use in offering ACL reconstruction. There is evidence that 1/3 of the patients may not need ACL surgery. These are the ones who are limited with desk chair job, who are in their 40s or 50s. 1/3 may not need ACL surgery. These are maybe between 30 to 50 who does desk job in limited activities and not so overweight. 1/3 of the patients need the surgery. These are the ones who are younger patients, whose joint is very unstable, whose weight is a bit on the higher side. They have any associated injuries to other ligaments or the meniscus in the knee joint, and how the articular surface is. If there is any damage to the articular surface. All this will be taken into consideration before we decide whether this particular patient with ACL tear needs surgery or not. It doesn't matter whether you're an athlete or not, but there are certain criteria we need to follow to make a decision whether you need surgery or not.